Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center. Today I'm going to talk to you guys about retinols. So there are retinols and then there is also tretinoin, which is available by prescription. Retinol is a type of vitamin A and so is tretinoin. Both of these are topically applied to the skin. We also have an oral form of vitamin A, also known as Accutane, and that is something where patients who have very severe cystic acne might take Accutane to help reduce their breakouts. But very commonly we use the topical retinoids. I think that they're useful for just about anyone, not just patients who have acne, because it certainly helps with that, but it also helps to fight the aging process. And so we'll go over some of the benefits of the retinoids and how to use them and a bit about what they do and how they work. So like I mentioned, there are two different forms. There are retinols and then we have retinoic acid. So retinoic acid is a prescription form of vitamin A, and retinol is actually available over the counter up to about 2%. Now, if you want a higher medical grade retinol, then we have those available, for example, at our office, and they can even go up to 10%. The retinols that we have in our office also have some caffeine in them and green tea as well as hyaluronic acid, so it's not as irritating to the skin. Retinols work a little bit slower than tretinoin or retinoic acid. So retinols actually have to be converted to retinoic acid in the skin for them to actually work. So the advantage is a bit less irritation and inflammation when using a retinoid. And really, if you're using it long term, it's fine. And in the higher strength, you do get a good clinical benefit, especially when it comes to anti-aging and acne sort of concerns. So what these vitamin A derivatives do, these retinols, is that they reduce inflammation. So that's one mechanism of action, is just to reduce overall inflammation. And that helps in the whole anti-aging process. It also, the retinols help to stimulate new production of collagen in the skin. So we do lose collagen and we form all types of free radicals from sun exposure, from smoking, from pollution in the environment. So it's really important to have a retinol that can help combat some of those problems that occur in the skin. We also see that the retinols help to reduce the bacteria load on the skin by keeping the skin exfoliated. So patients who have acne, for example, might have skin that's not exfoliating at a normal rate. Some patients with certain skin diseases like psoriasis or eczema may also benefit from a retinoid to help that skin exfoliate a little bit more normally and keep the pores from being clogged and then harboring bacteria under the skin. So like I mentioned, reduction of inflammation, unclogging of the pores, helping to stimulate new production of collagen will help fight sun damage, but also help to fight fine lines and wrinkles. It's also helpful in patients who have scarring or have just started to get stretch marks. It's a great idea to get on a retinol to help combat that and to help the skin heal a little bit more normally without scarring. So these are some of the benefits. Retinols can be irritating to the skin, so you have to kind of introduce them gently and get your skin used to these products. I sometimes like to really start patients on a retinol versus going straight to retinoic acid. For that reason, use a small quantity. Sometimes I have patients only use it maybe 2 or 3 times a week, and a really small pea-sized amount that is spread over sort of the 5 different dots on the skin, and then you just rub it in. You try not to get it too close to the under eye area. That skin can be a little bit more irritable and prone to reactions. But yeah, you can spread it in all those areas. You can also spread a little bit on your neck and use it in the evening ideally. And then you can also use a moisturizer over that if you need to. And then I like to couple that with a vitamin C product in the morning or some other antioxidant. Now, like I mentioned, the retinols that we have in our office do have some built-in caffeine, green tea, which is a great antioxidant, and then also hyaluronic acid, so it gives you a bit of moisture. And we call this our retinol smoothing serum, and it's really nice. Patients actually really love it. If we need a stronger version of that, then we'll go to the tretinoin or the retinoic acid for those patients. And we can gradually get you up to higher and higher doses as your skin can tolerate it. So the first step is to use it maybe just 2 or 3 times a week, and then you can gradually, like month by month, increase it to more frequent use until you get to 5 days a week, and then we can increase the strength and keep going until your skin can actually tolerate the product. So that's a bit about tretinoin, retinoic acid, retinol, and please come see us if we can help you with any of your skin concerns. Do like, comment, and share our posts. And thank you so much for watching.